I'm Dr. Dina. I'm a mom of 3 young boys and a pediatrician. I love sharing kids' health information. One of the most common things I see each day is diaper rashes. I have lots of newborns and little kids in my practice, and where there's dirty bums comes rashes. Firstly, you want to make sure you're using very absorbent diapers. Whether these are disposable diapers or cloth ones or prefab ones, make sure that you change your baby very frequently. The more they're in pee and poo, the more moist they are, the more likely they are to get rashes. When you wipe them with a wipe or face cloth or paper towel, make sure that the bum is dry before you put the diaper back on it. If you leave it wet, they're more likely to get yeast infections and irritation from the moisture. So change them often, use a very absorbent diaper, like whenever you can, and use a wipe and then dry them easily. There's 3 main types of diaper rashes. The first type is the most common. It's called contact dermatitis. It's irritation of the skin around the bum from moisture, so from pee and poo. It looks red, it looks irritated, it can get quite raw in fact. But the trick is, the areas where the diaper and the poo and pee are not in contact, typically the folds of the skin on the groin, they don't have rash there. When you have a contact dermatitis rash, the red irritation, layering a layer of zinc oxide is the most helpful thing. It's a barrier. It protects the skin from contact with the pee and the poo. A very thick one, like this one, which has 40% zinc, is a good layer of coating. You want to put it on like icing on a cake, thick, thick, thick. Then when you go to clean your baby's bum, you want to wipe really gently with your wipe, or even better, a face cloth with just warm water. Take off the poo from the white layer without scrubbing it all off. That's really key. The contact you have with water or alcohol in a wipe on that irritated skin will make it worse. So layer on a thick layer of zinc oxide cream with the highest percentage you can find, and when you clean your baby's bum, only wipe the poo very gently off of the wipe. If you're finding that the zinc oxide is getting absorbed into the diaper and therefore not coating the bum adequately, you could also take a layer of petroleum jelly or petroleum-free jelly on top of your zinc layer. That way, the petroleum jelly gets absorbed in the diaper without the white coming off of the bum. Again, the more white that's on your baby's bum, the better the rash will heal and the faster, and the more it'll feel better. Sometimes you get a yeast infection on top of that area, and that looks like discrete little red bumps. So you start with the redness and then red bumps around the sides. These are called satellite lesions, and they're the tail mark sign that there's a yeast infection. And sometimes you might even need a prescription. So this would be for a yeast medication or for antibiotic medication if there's an infection with bacteria, and these your doctor will see. Then lastly, there's bacterial infections. These look the same, red, they're raw, usually they're very beefy red, so really angry red. There might be ulcerations, and there might be little areas of yellow, scab, or greasiness, and this is called impetigo. This kind of infection requires antibiotics to treat it. Most important, if you see little red dots, if you see yellow scaling or crusty lesions, or big ulcers, or your child's very uncomfortable or has a fever, please see your doctor. That's the most important thing. Make sure there's no infection that would require a prescription. And that's an easy way to detect diaper rashes and how to treat them. Can't get enough of Dr. Dina's information? Click subscribe below so you'll miss any new contents.